One of the important reasons that you need to know what a true therapeutic range is for older adults is that the last thing we want to do is to mistake the side effects and potential toxicity of lithium with other conditions. And this can readily happen in general practice. For example, one of the very common side effects of lithium is tremor, fine tremor. It's dose related. But if you misinterpret the tremor as Parkinson's disease, you run the risk of then treating a lithium bipolar patient with a drug that they don't need, which is being caused as a side effect. So you can see the kind of what we call pharmacological cascade that goes on. Other things you need to know about lithium side effects are gastrointestinal side effects. If you get higher doses and you get into the toxic range, very common to get diarrhea, stomach upset. The last thing you want is to start unnecessarily investigating and treating bowel disease when it's caused, in fact, by lithium. Another important consideration is thyroid. Lithium definitely can affect thyroid and lower thyroid so that you can develop hypothyroidism, and one of the things that we need to monitor on a regular basis. So the kind of side effects that are caused by lithium toxicity, such as Parkinsonism, tremor, gastrointestinal upset, and even cognitive impairment, which could be mistaken for dementia, are important things to know about and to be aware of, and make sure that we're not putting patients at risk because of toxicity and not because of other diseases that are so common in the elderly. I go back to my original statement that geriatric psychiatry is general psychiatry, only more so. Finally, the question about antidepressant, what do you do for treating bipolar depression? This is a much more difficult question. I think there is no easy answer other than the fact that we tend to avoid antidepressants so as not to make elderly people switch into mania. But the drug that is probably used most often, in addition to lithium, where depression or recurrent depression is an important consideration, is in fact lamotrigine, which does have some antidepressant properties and which is something that should be considered when lithium alone or other neuroleptics are not protecting people from the common and often prolonged depressive episodes associated with bipolar disorder.